So, good morning, everyone, or afternoon, different places. My name is Bai Xue, and I'm from the Hong Kong Polythecnic University, and it's my pleasure to be here today and to share with you the long-term care system in Hong Kong. And actually, in Hong Kong, it's quite similar as many other developed societies globally. We are experiencing a very fast population aging trend. And in the year of 2021, the 65 plus accounted for over 20% of our whole population. And according to our census projection, by the end of 2030s, actually, every three individuals, there will be one older adult, 65 and over. So this kind of, population trend underscores the importance of developing or having a well-developed and healthy long-term care system to fulfill the growing demand for elderly care in the future. And so the objectives of long-term care services in Hong Kong are to enable the older adults to live in dignity, to provide necessary support for them, to promote their sense of belonging, sense of security, and sense of worthiness, to promote the well-being of frail older adults in all aspects of their life. And for those who are relatively healthy, we'll try to enable them to remain living in the community for as long as possible to age in place. And for those who are relatively more frail or with, more moderate or severe functioning impairment, we hope to make sure that they can be taken care of in licensed residential care homes for the elderly. So these are the objectives of long-term care systems services in Hong Kong. And let's take a look at the key components of long-term care services in Hong Kong. And actually, long-term care services in Hong Kong can be categorized broadly into community care services and residential care services. And under community care services, we have like integrated home care services, enhanced home and community care services, as well as daycare center and unit for the elderly. And under the residential care services, we have home for the aged, care and attention homes, and nursing homes, depending on the care needs and the functioning level of the applicants. And to ensure that the services are provided, up to the standard. So it is required that all residential care homes for the elderly need to, be licensed and comply with the licensing requirements in respective of like management and staffing, facilities and equipment, location structure, design of premises, building safety, fire precautionary measures, health and hygienic conditions. And if an older person is suffering like health condition deterioration in his or her health condition, when he or she needs to they can submit an application, but the first step usually they can raise a request with the help of a responsible referring staff from a medical service unit or integrated family service center or the elderly service unit in the district. And then the responsible and referring staff will conduct the initial screening and refers the older adult for arrangement for the standardized care needs assessment that's appropriate. And then the certified assessor, usually they could be social workers, physiotherapists, occupational therapists, or nurse, who have been well trained and certified to conduct the assessment through home visits and face-to-face interview. And then the responsible or referring staff will explain to the older person the assessment results and the services matched. And responsible referring worker and then will formulate, a care plan for the older people and assist them to apply for suitable services. And so they will, and then they will assess and to have, matched long-term care services as appropriate. But before they can really, use the services, they usually will be put to the central waiting list. So they have to wait for different types of residential care homes. They have to wait around 3 years sometimes. So sadly, sometimes we see that some of the applicants, they died before they could get a place in the residential care homes. And even you have to, even just for the standard care needs assessment, you have to wait up, to 6 months before you can have the assessment. So to solve this problem, actually, our government launched the community care service voucher scheme for the elderly. So actually, for our long-term care system, we're mainly a needs-based. As long as after you go through the standard care needs assessment and you're eligible, like be determined as mildly, moderately, or severely functioning impairment, and then you will be put to the waiting list. And then you have to wait enough time, and then you will get a place. So this is originally like purely needs based, and to solve the problem of the very long waiting time, the government launched the community care service voucher scheme, targeting those who have been waiting. Okay, they're on the waiting list, or they're waiting for the assessment. So the voucher scheme actually uses a money following the user. So it provides more flexibility to the applicants, because they could select the recognized service providers under the scheme, and they could modify their service items and volumes as needed. And also they use like the affordable users pay rule, meaning that you're more affordable. You can afford, the more you can afford, the more you have to pay. And less you can afford, the more aid you will receive. So the services actually, once you submit the application, as long as you're eligible, usually you will get the voucher within a period of 2 to 4 weeks, which is very fast. And the service delivery modes include center-based, home-based, or a mixed mode of service delivery. And there are 6 co-payment tiers depending on the results of Ming's test. If you're if you the minimum, that the percentage that you have to pay, for some people they only need to pay 5% of the whole service package, and some of them have to pay up to like 40% of the whole service package. So according to the data from our government, the maximum monthly voucher values for 2023 to 24 is around 10,000 Hong Kong dollars. That is around 1,000 pounds. Okay, so each month, the maximum that you can the voucher value that you can get. And SWD, our social welfare department, will conduct a means test. And also, the government will be responsible for paying the balance of the value of the portfolio of the voucher services. So let's take a quick look at the effectiveness of the scheme. So actually, since the first phase was implemented, the number of vouchers got increased from 1,200 to the most recent 12,000 vouchers in number. And as for the take-up rate, actually increased from like 46% for the first phase up until the most recent 86%. So the take-up rate is increased a lot. And the waiting time of center-based service, although in the first few years got increased a little bit, but recently we can see a declining trend. And as for the community service voucher capacity, actually it has increased during the past few years. So we can to some extent we can see this scheme is pretty effective. And in future, actually we're still facing a lot of challenges, and I think some of the societies that we're going to share here, maybe we share some similar challenges, like there's increasing demand for community care services and residential care services, and there is serious manpower shortage in the industry of residential care homes, especially like the care workers and program workers and even the social workers. And now, especially Hong Kong, we are facing quite serious population immigration trend. So that will also, contribute to the serious manpower shortage. And the capacity of land, because in Hong Kong we have limited land, we have highly dense, place. So the capacity of land is limited. So the amount of services that can be provided also, reached a bottleneck. So the way forward, our government, of course, will need to formulate short, medium, longer term targets in light of the waiting situation and actual needs of different long-term care services, and need to assist in training and recruitment of additional care workers, and identification of sites to solve the current waiting problem. And also the government is nowadays quite active in planning and discussing for the potential of, developing of the long-term care services in the cross-boundary, we call it cross-boundary elder care. okay, in the Guangdong, Hong Kong, Macau, Greater Bay Area, which because in Guangdong we probably have more space and so and have more land resources. So that's also one of the direction that our government is currently considering. So I think that's a very brave introduction of Hong Kong side, and I will, yeah, I will end here. And if you have any questions, we can further discuss later. Thank you.
Thank you very much, Johanna, and it's my pleasure to present long-term care in Singapore. It will be a very interesting comparison with the case of Hong Kong, as Professor Bai just talked about. The two societies are both very metropolitan setting and also with quite a powerful government. I would like to, I think my presentation will firstly talk about the rationale of long-term care in Singapore. Um, in order to understand the long-term care model of Singapore, we better start from a very unique philosophy of Singapore's social policy. That is the active government support for self-reliance. It looks a little bit paradoxical, but the Singapore solution of social policy is featured by the individual responsibility reinforced by the public management. In that sense, the Singapore government consider it is the duty of the government to protect people in the market, but uh, people need to help themselves first. So this is a kind of interesting combination. We call it individual responsibility reinforced by the public management. And this type of philosophy has been translated into a very special type of social policy with regard to healthcare and welfare. You can see Singapore have this very famous CPF system. Basically, the Singaporeans need to go through this compulsory saving system to put their money under the government account. This account has been divided into four parts, each of that in charge of certain function of life. For example, there's an account saving for the pension for later life. There's account saving for housing. We call it ordinary account. There's account saved for the medical needs. And when we talk about health, this Medisave account is mainly the account we should focus on. And based on this type of rationale, in terms of healthcare financing in Singapore, the government will firstly provide subsidies, and after that, individuals will need to pay out of this Medisave account. And you can see this very interesting tiering system. Uh, Clearly, the money comes from elderly people themselves, but reinforced by the support of the government. Under this type of rationale of social policy, Singapore has started to think about population aging as early as in the 1980s. It has been quite a long journey for Singapore to kind of improve its rationale on how to face the population aging. As you can see, like the Asian tigers, just similar to Hong Kong, Singapore is also aging very fast. Uh, and the unique rationale of Singaporeans is to highlight the so-called family at the first line, and later move to build up a successful aging society. And in very recent years, this strategy has been operationalized into very specific strategies along four dimensions in terms of employability, financial security, holistic and affordable healthcare, aging in place, and active aging. Now, let's talk about the long-term care model. Under this general social policy and the specific thinking about aging policy, is Singapore having a LTC model? I think it's hardly to say that Singapore has a unique model because the Singapore's model is under very rapid transformation now because of a lot of challenges. But still, in comparison with other long-term care models in the world, Singapore has some interesting features. First of all, from my point of view, I think Singapore highlight on the sustainability of the system a lot. They are very cautious in making the budget for the LTC demands, and they have different strategies at different levels to make the system of LTC more sustainable. First of all, at the individual level, I think Singapore government make a great effort to promote health of older persons, and they want to prevent disease and disability in order to postpone the onset of disability. Therefore, kind of reduce the cost of long-term care. In the family level or the household level, it's very interesting. The Singapore government clearly put family at the very first line. I think this is also the choice of many East Asian societies. And that is family needs to be the first responsible stakeholders for people who need long-term care. And uniquely, Singapore has this FDW, foreign domestic worker. Uh, Actually, although Singapore is very small, but Singapore is the largest employer of foreign domestic worker in the world, according to foreign domestic worker per capita. And therefore, a lot of foreign maids are actually taking care of Singapore older people. They are the major forces for long-term care, actually at the family level. At the community level, Singapore government rely heavily on the volunteer welfare organizations, NGOs, and then try to make great effort to promote aging in place. And this is a very coordinated effort in regard not only for the healthcare but also housing. I'm showing you this picture showing like in Singapore housing project when the government was trying to build up housing for older peoples to facilitate aging in place is actually one of the major tasks, and this actually provide improved condition to reduce disability in later life. Many of the ADL-based disability are very environmental embedded. By improve the environment, actually could effectively reduce the cost of long-term care. And lastly, at institutional level, I think it's very unique for Singapore to promote aggressively for this integrated care in order to promote a holistic system combining medical care, elderly care at both the institutional level, hospital level, community level, and household level so that the whole system could be more cost effective and therefore having better sustainability. And after talking about this basic rationale, I would like to give you some details. And this is the current Singapore LTC service and facility from the Ministry of Health. As you can see, instead of the residential LTC services, Singapore is promoting actively about service home-based and center-based. And these home-based and center-based are usually located in the community level. And the Singapore government try very hard to provide the long-term care service at community level and to prevent elderly people to end up in the residential facilities in order to promote the so-called aging in place. And I would like to, at the very end, I would like to talk a little bit about this financial arrangement. These are the major financial arrangement for the long-term care social insurance in Singapore. As you can see, the MediSave, which is in the middle, MediSave Care, and this is the account under CPF. I already show you the CPF accounts. And for long-term care needs, people actually could withdraw up to $200 from this account. And using this account, elderly people are expected to buy the Care Shield Life, which is a long-term care insurance scheme covering the development of severe disability. And in addition to it, a long-term care insurance scheme is called Elder Shield, was also implemented. Beyond this major scheme of financing, and the government also provide allowance to support people, with foreign domestic workers. You can see this migrant domestic worker levy concession for people with disability. And also, they are really concerned about caregiving training. The government provides some grant. So at the end, I mean, the Singapore model end up with some kind of statistic that is still the older people pay about 40% out of pocket for the long-term care. And the government will use about 42%, and the LTC insurance pay about 10%, and the donations count about 10%. And Singapore model is featured by co-payment and mean tested. And these are another government schemes for the lower income people. You can see this interim disability assistance scheme, elder fund, pioneer disability. This specifically applied to a pioneer cohort of the Singaporeans. The senior mobility and enabling fund and home caregiving grant. These are all mean tested grant. And all these kind of institutional designs are well in line with the rationale of social policy in Singapore. Lastly, in terms of the workforce and the staff training of long-term care workers, there's no recent studies on this, but in 2018, I think the Lian Foundation from Singapore published a very important report. I would like to just highlight some of the major conclusions. And first of all, of course, Singapore needs more of the long-term care workforce in the near future, obviously because of the population aging trend. Second of all, the LCT sector is heavily reliant on foreign workers. In comparison with Hong Kong, Australia, Japan, Korea, as high as 70% of direct long-term care workers in Singapore come from foreign countries. And this is a very unique feature. And lastly, the Singapore LTC sector has a quite weak talent value proposition, featuring the low pay and lack of advanced opportunities. And that's why long-term care foreign workers usually leave Singapore within a quite short period of time. And these are the major challenges in face of the Singapore government to deal with in the near future. Thank you very much.
Okay. I'm Yueh-Ching, and thank you for Li Feng to join the presentation. Okay, next one. And the next one. Okay, I just skip the introduction. Okay, here, firstly, I'd like to give a quick overview of the context of long-term care LTC in Taiwan. And we are now a very low fertility rate and a rapid increase in the older population. And also more women are integrated in labor market. And fewer older people are living with their children. And since 1991, the number of families hiring live-in migrant care workers has increased year by year. So you can see the slide here, just a very brief data. And the next one. The care needs of older people in Taiwan, we can look at 4 main models: family care and care by live-in migrant care workers, residential care, and home or daycare services. And the national surveys from 2017 and 2022 show a decline in family care and a rise in the other 3 models, including residential care. Okay, next one. And regarding welfare policies, just like in Hong Kong and Singapore and Taiwan, also like other East Asian countries, is often described as productivist or familistic. And in 2015, Taiwan introduced the long-term care service law, which was implemented in 2017. And this law entitles for older people and disabled people to access long-term care services, but the benefits are determined by disability level and the family income. So it is a means-tested system with co-payment requirement. This is also very similar to Hong Kong and Singapore cases. And the next one. And then we have started the LTC 10-year scheme from 2007 to 2016, and we are now in the long-term care 2.0 scheme from 2017 to 2026. And this version enlarges coverage to include disabled people of all ages, and also those ages 50 and older with dementia. In addition, the cousin system increases home hospital care and support centers for family caregivers. And then the assessment for service needs is based on 8 levels of disability, with co-payment required for those not from low-income families. And the services and assessment are provided by the local authority and run by LTC management centers. And the funding for LTC comes not only from the government's budget, but also from the taxes, like estate, gift, property, and tobacco, and as well as donations and interest income from the LTC fund. And the LTC fund was just established in 2017. And the financial and the policies are regulated by the central government. Okay, next one. And Li Feng will continue the presentation. Okay, Li Feng, please.
Okay. Taiwan case is quite similar to Hong Kong and Singapore. So in Taiwan, if we want to discuss on long-term care service, it's kind of we also need to bring the role of migrant care workers in Taiwan. So just like many countries facing the shortage of care labor, Taiwan also have our own strategy to incorporate or unincorporate migrant care workers into local care service and systems. However, the Taiwan government has the dual systems of care labors. So for the families who hire migrant living care workers already, they are not entitled to the use of formal long-term care service provided by the government, because the government consider the individual family already solve their own care needs through markets. So you can see, although the government try to have the reform in long-term care system from 1.0 to 2.0 and try to attract more local workers participant in care industries. But you still can see the numbers of on the left, you can see the numbers of migrant care workers has increased very quickly. It's also because the employment of migrant care workers in Taiwan is much earlier than the establishment of long-term care system in Taiwan. So now most migrant care workers, they are working in the private household rather than the institutional settings. So we can say there is the living the living model is dominant. Next slide, thanks. Okay, so we can say then the failure to integrate migrant care workers into formal long-term care systems result in expected and unexpected consequence. So for the families, although although the family already hire migrant living care workers, but the family members, especially the women, still need to participate in the coordination and the arrangement of care. So it's not only reinforce the family responsibility in terms of care, but also reinforce women's responsibility of family care. And the second, just I mentioned earlier, because families hire migrant care workers, they are not entitled to LOTC service. And so under this context, it seems like government shift the responsibility of training and managing workers to individual family, and it also bring the consideration of quality of care or the well-being of care recipients. So now we move from the perspective of family to the perspective of migrant care workers, because we have the dual systems of care workers or care laborers. So migrant care workers, they are not recognized officially as long-term care workers in Taiwan. So they are not entitled to receive formal training or any on-site job trainings. And another issue is for care workers working in private household, they are excluded from the standard labor aid, which regulates workers' rights and the relevant benefit. And because migrant labor policy in Taiwan is based on gas workers systems, so migrant workers, they have very limited freedom to change their employers, and they don't have rights to family reunions. And for migrant care workers working in institutional settings, usually they encounter racial division of labor. They are required to undertake a night shift and perform the more undesirable tasks, which local Taiwanese workers don't want to take. Next, please. Thanks. Next slide. Okay. So now I move on to talk about the future for migrant care labor policies. But here we can see the government, right now the government has a very different attitudes toward the NGO. And so for the government, it seems the government still continually depend on migrant care workers as the solution for care needs. I can show you some examples. First, last year, the government just lowered the assessment criteria for hiring migrant living care workers. I think it's also the regulation Taiwan have is quite different from Hong Kong and Singapore. And second is right now, because Taiwan is competing the migrant care laborers with our neighbor Asian countries such as Singapore, Hong Kong, and also Japan and Korea. So now the government try to expand the sending countries of migrant workers, such as we just signed the MOU with Indian government last month. And so right now, the government still insists to keep the dual systems I just mentioned earlier. And for the NGO side, the NGO people try to draw our attention and try to emphasize the importance to pay attention to migrant workers' rights and the care justice in the transnational context. So NGO people try to argue that it's very important to include live-in care workers into the labor protection, and also advocate for the G2G, the government to government direct hiring system. And of course, it's very important to integrate migrant care workers into long-term care system. I already point out the gap between these two different policy. And also now in Taiwan, because the one-on-one care is the kind of the dominant care model. So the NGO people also try to promote we need to go beyond this one-on-one model and try to imagine an alternative. So I'll give the last slide to Qing.
Okay, thank you for Livan. And here just the challenges for current long-term care policies in Taiwan. And for sure, many challenges, yeah, for the system need a resolution. And just like many other countries, the major issues are such as demographic challenges, and with more older people needing support and a shortage of care workers, the low pay for care workers. And we also have limited financial resources. And one big debate is whether to continue with the current system called LTC 3.0 or to switch to a long-term care insurance model. And in Taiwan, another big challenge is how to include migrant care workers in the long-term care system and how to balance the rights and the needs of these migrant care workers and the users. Okay, so this is our presentation. Thank you for your attention.
Thank you very much to both of you for these also detailed insights on the migrant care worker positions and challenges, and also for this very nice summary of all the challenges at the end. Yes, so we now open for some questions to the presenters. We already have 2 questions in the chat. Maybe we can start with them while you think about other questions. So there's one from Meredith. Yes, so there's a question on Taiwan of who is responsible for management of this fund, including resource generation from different sources mentioned, such as fundraising. So on the long-term care fund in Taiwan, who's responsible for managing this? Maybe you can say something on this quickly, Yueh-Ching or Feng.
Okay. And Livan, I think this is kind of the central government. Yeah, and the fund, actually just the government try to have much more money, but now the debate is we still feel this is not so stable because it's based on interest rate. Yeah, so yeah, Livan, correct.
Yeah, so just like Qing mentioned, we still have the debate between the insurance model and the tax-based model. So now the fund is based on the tax, but it's kind of interesting because we government also increase the tax of tobacco, and so because we try to discourage people from smoking, so the tobacco tax also also goes to this fund, and it's managed by the central government. Yeah.
Thank you very much. And then there is another question in the chat from Simon Bottery. Did you want to quickly ask it yourself?
Yeah, so my question was about the Singapore scheme. And I may be misremembering this, but my memory is that when ElderShield first started, the financial contributions to it were voluntary, and that they later became compulsory. And so I wanted to check whether that's correct, whether my memory of that is correct, and if so, what the reasons for that change were.
Exactly, Simon. I think you are very right. At the very beginning, ElderShield insurance was voluntary, but now I think it ends by 2021 because CareShield has been taken the place, and is compulsory for all Singaporeans born in after 1980s. That's first issue, and about why I think this is the style of Singapore social policy. The same logic applied to the relationship between MediSave and the MediShield. So the government usually will open it for a voluntary choice, but later, make it compulsory for everyone to join. Yeah.
Can I just ask briefly, when it was voluntary, is there any idea of the percentage of the population that was paying in on a voluntary basis?
Yeah, there is some research showing like the take-up rate was not satisfactory due to various reasons, and therefore we have a second round and try to make it compulsory for everyone. Yeah.
Thank you. That's really helpful.
Yeah. Thank you.
Thank you very much. So we have a question from Adelina.
Yeah, I've got a question for Shui Bai. You mentioned workforce shortages, and we've heard a lot about the migrant workers in Singapore and Taiwan. I was wondering if you could say a little bit more about the situation, the use of migrant workers in the situation in relation to that in Hong Kong.
Yeah, actually, quite similar is Taiwan. In Hong Kong, we do have a lot of migrant live-in domestic helpers, taking care of childcare, helping with childcare and elder care. But for in the formal long-term care system, we don't really rely much on the foreign migrant workers. I think one thing is that when it comes to migrant workers, Hong Kong government is quite conservative, and our people will also have a lot of doubt or questions regarding the feasibility and whether that will influence the employability and work opportunities for local people and things like that. But actually, we do see there is a shortage in the human resources, especially in the elderly care sector. And so actually, the government now is trying to increase some quota for inviting some of the migrant workers from the mainland, especially from Guangdong province, who can also speak Cantonese, and because they care a lot about whether they could provide similar services in similar quality, as well as whether they can communicate well with older people as well as the local workers. So I think the government is trying to exploring the possibility of increasing the quota of getting more migrant workers in the elder care sector. But I think in the short term there will not be a significant change in the policy. Yeah, but that's still be one of the directions that we'll explore.
Yes, thank you. My question is basically for the Taiwan case, but I think maybe also similar to the Hong Kong case and the Singapore case, because I realized that it seems that the migrant care workers is the common topic for 3 cases. So I was wondering, are there any regulation or policy to identify the qualification of the migrant care workers, or would it be possible to provide any training for the migrant care workers to improve the quality of care? Yeah, thank you.
Yeah, I think it's a very important question, especially I think the Taiwan, Hong Kong, Singapore, and Hong Kong share quite similar situation. But if you look at the case of Japan, it's totally different scenario, because Japan has a very high standards for migrant workers, migrant care workers. But in Taiwan, it's quite lots of scholars or maybe NGO peoples. We try to push the government to integrate officially migrant workers into long-term care systems. Now, it's not mandatory for them to have to receive trainings before working in Taiwan. I think our government only say they need to have 96-hour trainings, but it's not necessary direct relate to elderly care. It can be cooking, language, and so on. Yeah, so now it's the I think now's the major concern of migrant living care labor. Yeah.
And I think in Hong Kong, like similarly, how to provide sufficient training to make sure that the service quality can reach the standard as we expected is also one of the main concerns about whether we should and we can expand the quota for, getting the migrant care workers in the long-term care systems. But although, as I mentioned, we do have a lot of migrant domestic helpers helping each individual family at home, but we don't really count that as part of the long-term care system. But because as long as you've got a subsidized residential care homes or, subsidized community care services, you probably you don't need to rely on the foreign domestic helpers, living domestic helpers. And at the same time, for the living domestic helpers, as just shared by the Taiwan case, I was quite surprised that the government will not consider the applications from the older people as long as they have a living domestic helpers, because I'm not sure whether they are professional in terms of providing long-term care services for those who are really frail, and whether they could handle all the care tasks, and how to determine whether the caregiver is hired specifically for the older people, for the older person in the family, or for general household chores or child care assistance. So I was quite surprised to learn the government use this way to prevent some of the participants from some of the residents from applying for the long-term care system. But in Hong Kong, we do see this as separate. Although foreign domestic helpers can support, can assist, but they're not necessarily counted into the long-term care system. Yeah.
Okay, so we have 2 more questions. We have 2 more minutes, so maybe be very quick. We start with Meredith.
Hi, thank you. No, thank you to all presenters. They're fascinating presentations. Just a follow-up question on Taiwan and the financing. Obviously, this discussion around LTC insurance has been going on for some time. What is the reluctance or the arguments as to not bringing in the LTC insurance scheme? Thank you.
So Li-Feng, I answer. Why not? Yeah, Taiwan now actually since 2000, early 2000, yeah, Taiwan already planning to have long-term care insurance scheme. But I think this is a very political issue because different government has different interests. And actually, just what I have mentioned, this is part of the debate in Taiwan. For example, another 2 parties even say that they want to have long-term care insurance scheme. But now the cousin government, as I know now, yeah, maybe remain the same, but another side also say that maybe we are going to have long-term care insurance scheme. So I say this is really very big debate, and this is really a very political issue. So this is what the condition in Taiwan. And I think Taiwan is very, very, everything is very related to politics. Yeah, Taiwan is a very politics country. Okay, but I have one question. Johanna, can I also raise up my question?
Yes, please. Yes.
Yeah, because I'm also curious about the case in Hong Kong and Singapore. For example, in Taiwan, we always advocate from the NGO or human rights group always argue about that the migrant care workers should be included in our long-term care system. But I want to know how about in Singapore and Hong Kong, and in Taiwan also very interesting. Even government didn't recognize our migrant care worker, other formal care worker. Okay, but when we do the survey or government counting on our services provided, and the migrant care workers always included. Just like you can see the survey, we show very clearly how many older people are supported by migrant care workers or supported by family or something like that. This is very clear. Okay, but just very interesting. The family need to pay every penny when they hire migrant care workers. So this is very different from the society in Western. And in Taiwan, I'm not sure in Singapore and Hong Kong. In Taiwan, we want to hire migrant care workers. We also need to go through the government assessment. So the number is very clear. It's not from the black market. It's really very market oriented. And so can I just know something about Singapore case and Hong Kong things?
Okay, thank you, Professor Chou. I think Singapore is in an ongoing procedure of facing this issue seriously. And the government do regulate the companies who are kind of doing this type of business, and then try to provide trainings, and also trying to introduce some licensing system to better protect the welfare of the foreign care workers. Particularly, I think COVID-19 kind of put new lights on this issue. For example, in Singapore, during the COVID, we had the lowest mortality number, but most of the cases of infection happen in the foreign domestic workers, the foreign workers dormitory. So this really has been exposed as an issue, and the government has been paying attention to this.
Hong Kong, actually, as I mentioned earlier, in our formal long-term care system, I mean, the community care services and residential care services, actually, a majority of the services are provided by local care workers. We don't really have a large group of migrant care workers in the formal care systems, but we only, like individual families, we just hire foreign domestic helpers, living helpers to help to assist with household chores or assist, the elder care or child care. But when the health deteriorates for older people, when their functioning status get further, impaired, chances are that they will still submit the application and be put to the wait list, and then wait for the subsidized community care services, residential care services. And in Hong Kong, because our subvented residential care services and community care services are with very good quality and with relatively quite low pay, because the government has, strictly monitor the service quality. And that's why a lot of people want to apply for it and wait for it. And in our private residential care homes, actually, there are a lot of available places. But on the other hand, for the subsidized residential care homes, there's always a long list for different types of services. So I think that is why the government now also emphasizes very much on how to improve and enhance home-based care and center-based care to delay the residents' need for the residential care services. But in Hong Kong, I think maybe in Singapore, like we face similar situations, like we all live in very tiny little space at home. So it's not possible for you to do like age-friendly modifications. Like if you use wheelchair, it's difficult for you to move around in home. So that's why it also increased our demand for the residential care services in Hong Kong. And yeah, that's some of the additional information about our system and the services right now.
Thank you very much. So I think we are at the end, a few minutes over, and have to stop the very interesting discussion. But I really learned, a lot of also the comparative perspective is very nice between the three countries, and it's thank you again for presenting and for participating. So all for speakers. Yes, and so I don't know, Adelina, if you want to say anything else. Or...
I just wanted to say thank you. This was absolutely fascinating, and we could have discussed for another hour, I think, but we can come back to some of this, and we can have more sessions and maybe go more in depth in some of the topics in the future. Thank you so much to the presenters and everybody who attended and who's staying a bit longer, and we see you soon, I hope. Bye.
Thank you very much. Bye.
Bye.